Welcome back. Statistics show that over 70 million people live with chronic pain, and 4 out of 5 people in the United States will have lower back pain sometime in their lives. And when the pain just won't stop, it's time to turn to the experts for help. Joining me now is Dr. Tory McJunkin and Dr. Paul Lynch from Arizona Pain Specialists. It's so good to have you guys on the show because the one thing that everybody seems to have in common is some type of back pain. Before we get started on talking about that, first of all, tell me what you guys do, who you are.
Gail, thanks for having us on, and you are exactly right. The statistics are phenomenal. How many people have back pain? My name is Dr. Tory McJunkin, and this is my partner, Dr. Paul Lynch. We are both interventional pain management physicians. What that means is we have completed medical school, residency. We're both board-certified anesthesiologists, and then we did specialized training in pain management for those difficult people who have chronic pain have to suffer.
And would you say these are people, Paul, that, you know, they wake up in the middle of the night, they got that lower back pain, later in the day it's gone, but it comes back every night?
You know, every person's different, and there's so many different types of back pain. What we really focus on at Arizona Pain Specialists is diagnosis. And people could come to us with a fracture in their spine all the way to just a simple muscle sprain, and it's our job to find out what it is.
How does somebody know the difference?
You know, the most important thing is the physical exam, which is what we were trained to do. You know, I thought we might use you as an example if you're okay with that.
Okay, here we go. I'm ready to stand up. Here we go. What do you want me to do? Turn around?
So if you came into me with back pain, you know, the first thing would be a good physical exam. If you can kind of turn towards the camera.
Okay.
If your pain is more out on the lateral sides of your back, that's more consistent with muscle pain.
Right.
Sometimes people, when they lean backwards, that really elicits their pain. That's more joint pain, or what we call facet pain.
Really?
There's multiple minimally invasive treatments for that facet pain. If you bend forward, some people, they can't bend over, even tie their shoe.
Right.
That's more disc pain, which is between bones in your back. And then some people, if I just put my thumb right in the middle of your bone here, will elicit tremendous amount of pain, and that's more consistent with a fracture in your spine.
All right.
And these are simple things that we can do in the clinic to find out exactly where your pain's coming from.
I have a question for you because I know my friends say this is why I have back pain. I sit on the floor when I work on my computer. I like just sitting on a pillow, but then in the middle of the night I'll wake up with that low back pain, but it goes away. Is that something I would probably want to come to you for, so you could tell me to get a desk and do something else?
Absolutely. And patient education is such an important part of pain. There's a lot of places you can go, hundreds of places you can go for pain doctors. But Dr. McJunkin and ourselves are board certified. We're fellowship trained. We trained at one of the top fellowships in the country. And we even teach at Mayo Clinic a couple days a month in the fellowships where we train other doctors. If you come to us, we can get to the bottom of where your pain's coming from, whether it's simple or if it's a more severe problem.
All right, Tory, tell me about some of your patients that have come in and some of the successes you've had.
Good. Well, one patient that comes to mind is a gentleman who's 58 years old, and he has been suffering with chronic pain for over 10 years. He initially was on the job. He was leaning over, picking something up heavy like we all do, and he had pain that shot down his back into his leg. Just beyond that, he had to have back surgery. He had a spinal fusion. His pain never really got better. 2 years later, he had another surgery. They were really trying to help him out, but his pain just continued to get worse. He saw me. He was desperate. He was depressed. He'd had chronic pain for 10 years. He couldn't even lift up his own grandchild. We talked to him about some of the minimally invasive options that we had for him. I picked the very best option that I thought would help him, and it's basically a pacemaker for pain management.
Really? For the back?
For pain management, exactly right. We placed one of these devices in him, and his pain went from a chronic 8 out of 10 every day down to a 2 out of 10. And he's now able, he's kind of reclaimed his life. He's now able to enjoy things, and he can pick up his grandson.
So you guys must really might be the last resort for some people who've tried some of everything, chiropractic, everything, pills, whatever. They come to you and they said, I've tried it all. Can you help me?
Absolutely. And we see people like that every day that have seen multiple doctors, have tried multiple procedures, and they still can't find relief. And through some of our new minimally invasive, safe techniques, things that we can do, in 20 minutes, we've been able to give people their lives back.
Oh, well, you just told me I shouldn't be sitting on the floor working on my computer. But what are some other things? What are some other things that people can come to you for if they have back pain? Like if they haven't had 58 years or many years of pain. What if they've just got a pain in their shoulder that's in their back? Maybe they wouldn't think to come to you. Would somebody need to come to you still?
Sure, we treat pain of all sorts. We don't just treat back pain, but we treat chronic pain in general.
And one of the things that we really we try to do is to be comprehensive. We do physical therapy at our facility. We do imaging. We treat every patient across the spectrum. And, the plan that's right for you might be completely different for someone else.
It sounds like you guys really take a look at what's causing the pain first before you even offer any type of treatment.
Definitely. Yeah, and one of the newer techniques that we have nowadays, that they didn't have even just a few years ago is to treat fractures in the spine. In this area right here, they didn't have that kind of treatment option in the past. And Paul has a patient that he wanted to talk about with a fracture.
We had a couple months ago, a doctor that I work with, actually in Oklahoma, one of his patients came out here on vacation right before Thanksgiving and fell and got a fracture in their spine. And he called me and basically said, this patient hasn't got out of bed for 9 days.
Wow.
She went to the ER, they sent her home. She'd been laying in bed for 9 days, hadn't got up. Is there anything you can do? He gave me the call the night before Thanksgiving. We actually sent one of our doctors we work with who did a home visit, which you don't see very much in medicine anymore.
That's worth talking about right there.
Saw her on Thanksgiving morning. We actually did the imaging the day after Thanksgiving, and within 3 days we had done a new minimally invasive procedure where we placed a small needle into the fracture, put cement there to heal the fracture, and the patient within 3 days went back home.
Okay, cements for fractures, pacemakers for back pain. That's really great. Well, thank you for stopping by and talking about that with us. Thank you very much.
Thanks a lot.
Wow, I know. And what would you like to say to patients watching right now who have back
I would
pain?
say that if you're having pain today and you're one of the 1 in 6 Americans that live with pain every day, call us today, make an appointment. In most cases, you don't even need a referral from your doctor. If you do, we can work with them to get you a referral. Or go to our website at arizonapain.com and read more information.
Well, thank you very much. You just said it right there, arizonapain.com. The number is right there on your screen.